Hello, Dr. Dua. Many congratulations. And this is really a big achievement for you. How are you feeling?
Hello, Dr. Shabana. I'm so happy, and of course, I cannot prescribe my feeling about this journey. I'm so happy. And first of all, I want to thank you about for your effort and your support with me for all this journey. Thank you,
Ah,
Dr. Shabana.
thank you. Thank you so much. I'm really so happy for you when you gave me the news that you have passed. It was as if like my hard work has also paid off. Of course, it is your hard work, dedication, and determination. So, like, can you just tell us how you prepared for the exam? Your journey in short, the MRCOG journey.
First of all, about I will talk in general or in about the part three only, Doctor.
Yeah, as you wish, in general and part three. Yeah.
Part three, first of all, I want tell Alhamdulillah, thank Allah, and should will trust our Allah first. This is the first thing. The second, the most important thing in part three, doctor, to practice too much.
Yes.
And you have a study partner. Study partner is very important in part three. If you don't have in part one and part two, it is mandatory in part three because this is very important to practice every day. And also read also the guidelines to guide you about how to prepare yourself, and also because it's very important. And part three is different than part one and part two. Because part three is like to how to apply your knowledge. It's called applied knowledge. It's very
Yes.
important to practice with your study partner, and the study partner should be also honest and should be smart to help you every day to practice at least 5 to 6 stations per day.
Yes. So you were practicing 5 to 6 stations. That was before exam, of course.
Yeah, yeah,
And with
yes.
work, yes, it becomes a bit difficult
Yeah,
also. Yeah.
yeah, and also I want to thank you too much because without also your help and your advice and without your course, I cannot do it alone. Thank you, Dr. Shabana, too much. Thank you too much for you.
It's a teamwork, and I hope
Yeah,
your study partner also passed.
yeah, my study partner passed. My study partner is Ghada. Also, she take with you.
Right, Radha. Yes,
Yeah,
yes, Radha Salah, of
yeah,
course. Yes.
yeah, yeah,
Uh, yes. So both of you passed, so that is also a very good thing. Yeah. And
yeah, alhamdulillah.
yeah, how you started preparation? Like initially it was module wise?
Yeah, doctor. First of all, because it's the second attempt for me, the first one I don't prepare well. That's why
Yes.
my advice to all candidates should be prepare well. Don't rush to book for the exam without any preparation.
Right.
That is very important.
Yeah.
When I know about you and about your guidance, that's why I just call you, and also you guide me how to prepare. This is very important to practice. I start with you this one-to-one course, very important because also you give me advice about and we start this module today. Next week we'll do labor module or urogynecology module like that. I start to prepare well and study this one, and I call
Mhm.
my study partner by in this week. I all the week I practice with my study partner all the module. At the end of
Right.
the week, we'll
Yes.
meet together and we'll make a station about this one, me and you. And also very important to repeat everything, to memorize, and also to speak, to know how to speak. You can speak in front of the mirror with a study partner when you are cooking, when you are driving. This is very important to practice.
Yes, exactly. Yes, because initially, yes, it's going to be module wise because of course you have to cover 14 modules and there are so many stations in each of them. And
Yeah.
like many new stations came this time. So how did you tackle them in the exam? Some scenarios were new. Exam was a bit tough this time, I think.
Yeah, I will tell for all candidate if the new station facing you is not a big deal, because if you prepare well and you practice too much, you can deal with any new station, because they will put what is this called, like a frame for each module in like in labor module, as you told us, Dr. Shabana, like
Yes.
in labor module we should ask about certain question, and we should follow this certain question in each module like that. At least when you're facing any new module, you can go through this frame for each module. You can speak, because the
Yes.
most important in part three how to speak Even if you face any new case or a new station, you can speak if you follow the what is this called, this frame
Yes,
for
the
each module.
template. Yes, yes, that
The
template.
templates, yes,
Yeah.
yes, like that.
Yes, yes. I
And
mean,
also your
mhm.
PDF is very helpful, Dr. Shabana, really, because it's very simple, and you simplify all the words and all even the English very simple. That's why
Yes.
your guidance very important. That's why I advise everybody to follow the template. The template very important for each module.
Yes, yes, yeah. When I prepared the template, I always tried to keep it simple because, there
Yeah.
are some candidates for whom English is not the first language. It becomes very difficult to express the things. We know we have the knowledge, but sometimes it is difficult to express it in English language. So PDF is simple. At the same time, I told that you have to uh, like change this template and according to the station. I mean,
Yes.
memorizing the template is one thing, but you have to modify it also according to the station.
Yeah, yeah, and
Exactly.
also this template, your template, doctor, is very simple to the extent I can memorize very easily during the task. I am in the
Mhm.
exam. All of us
Yes,
during exam we have stress. This is
yes,
normal for all of us,
yes,
even
exactly.
third well. But your template is very simple. You can memorize easily. That's why in
Yes.
front of my eye, your template is very simple, very easy. That's why I appreciate
Mhm.
your effort, really, doctora.
Uh-huh. Thank you so much. Thank you.
Welcome, welcome.
Yeah, and you also worked so hard. I mean, whenever we had the session, you were fully prepared before the session. So that is also a very good thing. It's not that you are just dependent on your mentor. You are also doing your hard work. The mentors are also doing the hard work.
Yes, yes, doctor.
Yes,
Yes.
it's a combined effort, I must say.
Yeah,
Exactly.
like you told, doctor, it's like a teamwork.
Yes, it's a teamwork, of course.
Yes.
We are here to guide you people. And of course, you are doing all the hard work, reading a lot. Yes, and from reading, I would like to know, like, the recommendations are important, isn't it? Because in the structured discussion task, examiner can ask you anything. So, like I always said, that read the recommendations. So, what do you think? We have to be in touch with the guidelines, isn't it?
Yes, yes, of course, doctor should be read the recommendation of the guidelines because in the structured discussion they will ask me, even in the patient something patient task, you can speak with a patient with lay language, but in the structured discussion very important to read this recommendation because he will ask you at any question.
Mhm.
At least you prepare well to
Yes.
to answer well. Yeah.
Yes, yes, exactly. And I always used to tell you, don't rush. Keep.
Yeah, I know because you told me like that in the
Yeah.
structured discussion, very
Yes.
important. Doctor, I forget to tell you in my structured discussion one, the British doctor,
Yeah.
after I finish, and I don't know this is the, after I finish, he told me, excellent, excellent, good luck. I'm so happy when he told me like that. I
Okay.
remember you always when we are talking about the structured discussion. I remember you in this time, and I told, thank God that because you are my mentor and you guide me how to speak in this structured discussion. Thank you. Many, many thanks for you, doctor, really.
Thank you. Yeah, because I always say you don't have to rush. Never rush to finish the station in 10 minutes.
Yeah,
RCOG, they don't like it. They want a very calm
yeah.
doctor. It doesn't mean that I mean, the thing is that you have to say everything, but in a very systematic way and in a very calm way, so that you can
Yes,
cover all the important points. Exactly. Anything else you want to add? Any important tips which you want to give to the candidates who will
I
appear in the
I
exam?
want to tell them very important also mock exam before
Yes.
any before the yes very mock exam is very important, and nowadays the exam is face to face. Better to attend also this mock exam because it will break your fairness, your any, if you fear from the exam, if you fear from the if you have anxiety or like that, you should attend also mock exam, very important, doctor, really. It will
Yes, the
prepare you well.
offline. Yes, face to face.
Yeah, face to face
Yes.
is very important, really.
Mhm. And better to attend at the center where you have booked the exam, isn't it?
Yes, 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 very
Because
important.
you will be familiar with the place and how the stations are arranged. Yes.
Yeah, yes, it will help also too much really because it's like simulating the exam exactly. Because at
Mhm.
least when you go to the exam, you do well, and also you break your anxiety, your fairness like that.
Yes, yes, Exactly. And I hope you benefited from the course, from this
Of
one-to-one course.
course. Of course, doctor, I take many benefit from your advice, from your lovely voice, for how to guide me, how to speak slowly, because I know I speak very fast. This is my nature. But
Yes.
in the exam, when I remember your advice to me, Dua, please don't rush, speak slowly. I follow your advice, and thank God, Alhamdulillah, I passed. Alhamdulillah. This because of Allah. Then you, doctor. Thank you too much.
Most welcome. And it's like it is a very good feeling for us also. Like when we see, like you are just like my colleagues. So when we see our candidates and our colleagues passing, it gives us also immense pleasure, you know. So you are now a proud member of Royal College of Obs and Gynae. So all the best,
Alhamdulillah.
my dear Doa. Thanks for being here. And if you want to add anything, yes, please go on.
Thank you, Dr. Shabana, and many hugs and many kisses for you.
Thank you. Same for you. Same for you. And all the best for your future endeavors. May God
Inshallah,
bless
doctor.
you, bless your family. Keep shining, keep growing. Okay, Noah,
Okay,
thank
thank you.
you. Thank you so much.
Thank you.
Thanks for
Thank
giving
you,
the
doctor.
valuable tips and thanks for your time.
Okay,
Oh,
doctor.
my
Thank you.
dear. Thank you.
Okay,
Bye bye.
welcome. Bye-bye.
Bye bye.